Hi everyone. As per NIBH's 6th edition, IPC 8 standard, is the organization takes action to prevent or reduce healthcare associated infections in its staffs. In commitment, the organization implements occupational health and safety practices to reduce the risk of transmitting microorganisms among healthcare providers. Needle stick injuries are preventable. Safe practices protect healthcare workers. So, today we'll discuss sharp safety and needle stick injury prevention and management. Needle stick and sharp injuries are accidental puncture wounds caused by needles or sharp medical instruments such as scalpels, lancets, broken ampules, needles that may expose healthcare workers to bloodborne infections. Risk are exposure to HIV 0.3%, hepatitis B 6 to 30% if not vaccinated, and hepatitis C is 1.8% risk. Causes of needle stick injuries. Majority of the needle stick injuries occurs during the use of the device, following use, but prior disposal. So let's see what are the common causes of injuries. First one is unsafe handling work practices. Recapping, breaking or removing needles by hand, passing shafts between healthcare workers, improper disposal of used needles, transferring shaft to a different location. Improper disposal, overfilled shaft containers, using non-puncture proof containers, needles left on trays, beds and work surfaces. During clinical procedures, blood collections, IV cannulizations, injections, during suturing and surgical procedures, assisting uncooperative or moving patients, and during emergency situations such as code blue or trauma care. Human factors such as fatigue, long working hours, inadequate training or experience, or rushing due to heavy workload. Environmental factors includes poor lighting, crowded work areas, sudden patient movement. Common ways employees to have needle stick injuries or exposures: scalpel, recapping needles, splashes, suturing, or passing shafts. Now let's discuss on management of needle stick injuries. First one is first aid. Don't be panic. Stop immediately the procedure whatever you are performing. Dispose properly the contaminated gloves. Dispose the sharp instruments in a sharp container. Allow the wound to bleed freely. Do not squeeze. Ideally by holding it under running water and apply soap. Do not scrub, cut or suck the wound. If it is for eye splashes, rinse with clean water or saline. For mouth, spit out and rinse. Do not swallow. Report the incident immediately. Inform your immediate supervisor or in charge. Report to infection control and document in the incident reporting form. Third one is risk assessment. Assess the type of exposure, depth of the injury, source of patient, and vaccination status of injured staff. Baseline investigation has to be performed for injured person and source. HIV, hepatitis B, and hepatitis C after taking patient consent. Fifth one is post-exposure prophylaxis, that is PEP. If source is HIV positive, then start PEP within 2 hours, maximum 72 hours, and continue for 28 days or as per the hospital policy. If source is positive for hepatitis B, then if the injured person or the exposed person fully vaccinated and immune, then no treatment is required. If the person is non-vaccinated or non-immune, then consider giving immunoglobulin and hepatitis B vaccine. Hepatitis C, no PEP is available. Early detection and follow-up is required. HCV RNA, 4 to 6 weeks after exposure. Follow-up testing of anti-HCV, HCV RNA and ALT, 4 to 6 months after exposure. Counseling and support. Explain risk and treatment clearly. Maintain confidentiality. Advise safe practices such as avoid blood donation and safe sex. Follow-up testing is 6 weeks, 3 months, 6 months or as per hospital protocols. Documentation and review. Complete incident report. Root cause analysis. Implement corrective and preventive actions. Now let's discuss preventive measures. Standard precautions need to be practiced at all times. Treat all blood and body fluids as potentially infectious. Perform hand hygiene before and after procedure. Use personal protective equipment such as gloves, gown, mask, eye protection. Handle needles and sharps safely. Do not recap needle. In case if it is unavoidable, use one-hand scoop method. Do not bend, break or remove needles by hand. Use forceps or trays to handle sharps when required. Never pass sharps hand to hand. During procedure, ensure adequate lighting. Secure or immobilize uncooperative patients. Use kidney trays to pass sharps. Avoid rushing. Environmental safety. Keep work areas clean and clutter-free. Place sharp containers at point of use. Avoid carrying used needles long distances. Staff training and awareness. Regular training on NSI prevention and PEP. Orientation for new staff, students and interns. Display NSI posters in clinical areas. Ensure hepatitis B vaccination for all healthcare workers. Check anti-hepatitis B titer as per hospital policy. Maintain occupational health records. Housekeeping and waste management. Proper segregation of biomedical waste. Never mix sharps with general waste or linen. Train housekeeping staff on sharp safety. Encourage prompt reporting of NSIs. No blame culture. Conduct root cause analysis and corrective action. Use safety engineered devices. Dispose sharps immediately after use. Do not overfill sharp containers, that is 3x4 full rule. Wear appropriate personal protective equipments. Use puncture-proof, leak-proof sharp containers.